Taking a patient's health history is a conversation with a purpose, and the ability to communicate and relate therapeutically with patients is one of the most valued skills of clinical care. During the interview, you will draw on many of the interpersonal skills you use every day, but with unique and important differences. Unlike social conversation, in which you express your own needs and interests with responsibility only for yourself, the primary goal of the clinician-patient interview is to improve the health and well-being of the patient. So in the interview, you will try to establish a trusting and supportive relationship, gather information, and offer information. At the beginning of each encounter with the patient, greet the patient cordially and establish rapport. Address the patient by name and introduce yourself, giving your own name. Name tags are great facilitators of this. If possible, shake hands with the patient. If this is your first contact, explain your role in the patient's care. Never hesitate to ask how to pronounce the patient's name, and use a title when addressing the patient, saying Mr. Jones or Ms. Livingston. Avoid using the patient's first name unless you have specific permission. Greet and acknowledge each visitor in the room, but maintain confidentiality. Let the patient decide who stays in the room, and then make sure that only those specifically included in the conversation are in a position to overhear it. As an empathic listener, it's up to you to invite the patient's story. Sometimes you will want to make small talk first as a means of helping the patient to relax. In most cases, the patient's health history will soon begin to flow spontaneously. Give the patient your undivided attention, and remember, the task of organizing this information will be your responsibility. Later, you will have to turn the patient's words into a coherent narrative. So take notes and try to cover most of your questions now in the pre-examination. That way, you won't interrupt the flow of the examination with constant note-taking. Even if time is limited, try to appear calm and unhurried, because little can be gained by cutting the patient's story short. By using open-ended questions, you allow full freedom of response. Follow the patient's cues to keep the patient at ease, using specific language and words the patient understands. Personal and social concerns may emerge at any time during the interview. As you converse with your patients, it's important to employ various techniques to reassure, encourage, clarify, and validate what the patient tells you. With experience, you'll learn to avoid some of the pitfalls of verbal communication, such as inappropriate or counterproductive statements of reassurance, or verbal facilitation that, instead of encouraging patients to talk, merely interrupts them and derails their train of thought. With experience, you'll also learn to adapt your interviewing technique to specific situations and types of patients. Whether your patient is silent, overly talkative, anxious, confusing, angry, or even crying, you must never lose sight of the importance of listening to them and clarifying their agenda. Nonverbal communication, that is, communication that does not involve speech, occurs continuously and provides important clues to feelings and emotions. Becoming more sensitive to nonverbal messages allows you to both read the patient more effectively and to send messages of your own. Pay close attention to eye contact, facial expression, posture, head position and movement, such as shaking or nodding, interpersonal distance, and placement of the arms or legs. Your posture, gestures, eye contact, and tone of voice can express interest, attention, acceptance, and understanding, or, conversely, boredom, impatience, disapproval, and lack of understanding. Moving closer or engaging in appropriate physical contact, such as placing your hand on the patient's arm, can convey empathy or help the patient gain control of feelings. Be non-judgmental. Avoid reactions that betray disapproval, condescension, or embarrassment, or that tend to stereotype, criticize, or belittle the patient. Bringing nonverbal communication to the conscious level is the first step to using this crucial form of patient interaction. Establishing a supportive interaction through both verbal and nonverbal means enhances information gathering and itself becomes part of the therapeutic process of patient care.